I'm Matt Willis, Public Health Officer, and for today's COVID-19 report, I'd like to introduce the wonderful epidemiologist Jasmine Soriano, who works with the Department of Health and Human Services. Our team of epidemiologists collect, analyze, and report the data so that our decisions are guided by the best available information. These are the vital signs of our community, and we use them the way your doctor might use vital signs to guide your care. We've learned that a lot of people are following the data that we post on the website at coronavirus.marinhhs.org. We've had questions about differences in the way certain things are reported. Jasmine is going to help us understand the differences in the way we report cases over time and how the results line up and how we use them.
Hi everyone, my name is Jasmine and I'm a member of the Marin Epidemiology COVID response team. On the epidemiology team, we collect and analyze data to share internally for response and publicly so you can stay informed about COVID-19 and Marin. Today I want to talk about the difference between COVID-19 test date and report date and what percent positivity can tell us. COVID-19 test date is the date a person was tested with a COVID-19 test, exactly what it sounds like. COVID-19 test date is important to examine because test date is the closest date we have to when each person was infected. Therefore, when we look at cases by day using test date, what we call an epidemic curve, we can see trends that approximate new infections by day. This is what our public health officer looks at to make decisions in order to flatten the curve. However, when looking at positive cases by test date, we usually see lower numbers in the most recent dates, like yesterday or today. This is because for the people who were tested yesterday and today, Marin Public Health has not yet received their results from the lab. We don't receive test date until we receive the result. A week from now, yesterday's date will show more cases by test date than it does today, likely. Now I want to talk about COVID-19 report date. This is the date we receive the result from the lab. Report date is useful because it is actionable and it is easy to interpret. When we find out about a positive COVID-19 result, the communicable diseases team follows up with the case for contact tracing. Unlike cases by test date, recent dates are complete when looking at cases by report date. We're testing more in Marin than we were before. With the increased testing, we're likely to see a higher number of newly reported cases. This does not necessarily mean there are more COVID-19 infections among our community. Because we're testing more, we know about more of the infections and can take action like contact tracing to reduce transmission. I want to explain how we use a measure called percent positivity to better understand prevalence of COVID-19 as we increase testing. Percent positivity is the number of positive COVID-19 tests out of the total number of tests conducted. Percent positivity can give us insight into the prevalence of COVID-19. It also shows us we're doing enough testing to sufficiently find cases. If we are testing more people in the community, not just those who are the sickest, we will see a lower percent positivity that tells us we're doing well with testing. I hope this sheds light on the work of the epidemiology team and the complexity of COVID-19 testing data. Thank you very much.